See, first thing is that all sugary foods, fast foods, oily foods are bad for acne. See, there is practically no difference.
Okay.
These are the three different names for the same disease.
Okay.
Acne is a technical name,
Right.
and other two are just common names. So there is really no difference.
Okay. Hello and welcome to BeyondSkin, a skin initiative by Dreamy Derma in association with Gloderma Lab Private Limited, where we dive deep into the world of skincare, trends, and everything in between. I'm your host Shruti, and today we are discussing a topic which is so close to everyone, that is acne. There is a lot of confusion about what causes acne and how to treat them. So, to help us understand diet, skincare, and hormones, we have an amazing guest with us, Dr. Dipak Kulkarni. With over 35 years of experience in dermatology, I think he is the perfect person to help us solve all our questions. Namaste, doctor.
Namaste.
I'm very happy that you are here with us.
Yes.
So, I have first question. What are the basic myth about acne?
See, the basic myths which are perceived by the parents and the patients, the adolescents, are different. Parents feel that acne is a very, very trivial condition
Right.
and will subside over a period of time. Nothing should be done, no treatment should be taken, and they, in their own teenage, never had to take any treatment. So today's kids also need not take the treatment. That is their
Right.
misconception.
Right.
On the other hand, they feel that just some corrections in diet should be able to correct the pimples.
Right.
If you go to the adolescents, they feel that whatever is social media, the moisturizers and sunscreens and the face washes, they can treat acne of any kind. So then they feel that just going to a doctor is not required. They can treat their acne themselves. So
Right.
these are two different kind of problems. They have their own misconceptions, and there is another confusion about whom to go, because there are so many people who call themselves as cosmetologists, but
Right.
actually the real person whom the people should go in case of medical difficulty is the dermatologist who has completed MBBS and done some postgraduate degree or diploma beyond that. So he is the right and the authentic dermatologist whom the people should go. So that there is a confusion there also, and because of that, acne sometimes is mistreated both by the patients themselves, their parents, and the misconceptions in the society. But in
Right.
reality, acne is a important disease for the adolescents. Now, with it's a lifestyle disease. So, in the today's modern world, there are a lot of dietary changes. We are westernizing our diet. The stress is there, and the whole lifestyle is changing. There is obesity and many other problems. So because of that, acne is not only increasing in number but becoming more severe, and we can see acne patients even beyond adolescence. We can see, getting a lady at 35 or 40 having acne is nothing new in my clinic. So
Right.
all these changes are there, and acne does require quite an involved treatment if it is severe from an expert like a dermatologist.
Right. So there are few points that you have said which are in my head because I suffered from very severe acne when I was a teenager, right? So first, when I was a teenager, I did not understand the difference between a dermatologist and a cosmetologist. So can you help us understand that as well?
Yeah, a dermatologist is a doctor who has passed MBBS and
Right.
done a postgraduate degree beyond that,
Right.
maybe a postgraduate MD or a diploma or DNB. These are some authentic degrees which are certified, and then he will have his own experience in the field of dermatology.
Right.
As again, there are so many people who call themselves as cosmetologists have done some course which is not medically qualified or the NMC qualified course. So that is the difference. But the problem is that many people feel that even just the cosmeceuticals can treat acne, and that's why there is a big confusion.
Right, right. One thing you said, like it's very common for you to see a 35-year-old woman to have acne, right?
Yes.
So because when I went to a dermat, she told me that, uh, like after 21 to 25, it's very, it's not that common to get acne. I'm 28 and I still have an acne today.
I must say that
Yeah.
acne can be seen beyond that adolescence. Having at 25 or 30, I get patients who have had two children, have done their family planning surgeries, and I mean their childbearing is over. Still, they are getting acne.
Right.
So this is a problem of the westernized diet and the modern lifestyle and the stress.
Right.
So this is a very common thing nowadays.
Right. So you said westernized diet, right? So it's very difficult for, now because it's very common part of our diet. So of course nobody's going to let it go that easily. But how can people create a balance like within our traditional diet and this western diet?
See, first thing is that all sugary foods, fast foods, oily foods are bad for acne. Many people feel that oil is bad for acne because probably oil gets percolated through skin. It's not that way.
Right.
Oil is a high calorie food. So all the foods which have got high glycemic content, those who have got high calories, should be avoided in acne. So because most of the fast foods, mithai, the oily foods, the typical food which is available in the fast food joints, hotels, etc., have got a lot of oil and the calorie content, and that's why that is not very good for acne.
Right.
As against that, if you have more healthy diet, like if you have uh, vegetables, fruits, salads, they are good for acne. It is not that non-vegetarian food is bad for acne. Only thing is that the way non-vegetarian food is made in India, we use a lot of oils.
Oil,
That
yeah.
is bad. In fact, some of the, I mean, fish contains a lot of omega-3 fatty acids.
Right.
So that way it can have an anti-inflammatory effect and may be good for acne. So there is nothing against non-vegetarian food as long as you are having it in less oily preparation and having anyway alongside adequate amount of vegetables and fruit in your diet.
Right.
And any diet which increases your weight, I mean, very simple to remember for anybody that any food which you know should be avoided to reduce your weight should be avoided in acne too.
Right.
There is one more thing that many a times this has been found that dairy products can also increase acne. Of course, dairy products are nutritious, that's why they need not be totally cut off. But I mean, ultimately, the rule is the same, everything in moderation.
Right.
So it's not that, I mean, whenever our kids go with their friends, their peer group outside in some MACD, they just don't have to have anything.
Right.
I mean, everything in moderation. Once in a
Moderation.
while, once in 15 days, it's okay.
Right.
But if they will have to strike a balance between a good diet and a good skin.
Right. So, when talking about diet, you said dairy food. There is dairy food, right? Oil is one thing as well. Apart from that, what all common things that people should avoid?
Chocolates.
Okay.
Yeah. So chocolates. I mean, the cakes,
Okay.
ice creams.
Sugar, basically, you're
Yeah,
saying.
anything which contains sugar, high calorie diet, and obviously, I mean, ice cream is really no because it contains milk also, and
Right.
also contains a lot of sugar.
Sugar.
So
Right.
all these things are better avoided.
Okay. Okay.
But one thing is that there is another aspect to it, that too much importance is given to diet in acne. All these points are important, but it is not so that diet is the only reason for acne. So
Right.
all these points have to be observed. But apart from that, there is a genetic factor which cannot be avoided. If somebody, suppose your parents did not have acne at all, even if you are little loose in observing these dietary rules, still you won't get acne.
Right.
If you are a person who doesn't take too much of stress, or your lifestyle is like that you don't have to take too much of stress, you won't get acne. So
Right.
acne is a multifactorial disease, and diet is just one aspect of it.
Right. So, a person who's suffering from acne, Is there just one aspect? Let's just talk about diet, right? Diet. There is one diet. Then there are like using new products or products which might not be good for the skin. You said like there is genetic aspect to it as well. So is it normal for one person to have all those issues, or like there is different cases for all of them?
Exactly. So, as I rightly said right now, that acne is a multifactorial disease.
Right.
So, familial tendency, stress levels, diet, your weight, your hormonal balance, which is going on, any dietary, any drugs you are taking. For example, some people have to take anti-epileptic drugs.
Right.
They may cause acne. Some people have to take oral corticosteroids for some or the other disease. They are more prone to get acne.
Right.
Females who need to take some of the estrogen progesterone pills, either for their menstrual postponement or for as a contraceptive pills, they are more prone to get acne.
Right.
Cosmetics is an important reason why some people get acne. Those people professionally have to do grooming every day. The typical hospitality staff, the airline staff, all of them are more prone to get acne because of the cosmetics which they use. So there
Right.
are all these factors together ultimately lead to acne, and we have to consider all the aspects while we are treating the patient.
Right.
And what are modifiable should be modified.
Hmm. What is the difference between acne, pimple, and zit?
See, there is practically no difference.
Okay.
These are the three different names for the same disease.
Okay.
Acne is a technical name,
Right.
and other two are just common names. So there is really no difference.
Okay.
I mean, sometimes I hear patients saying that doctor, I have got pimples and not acne, which is
Right.
not the case. Even the mildest possible lesions, the so-called blackheads and whiteheads, are also technically acne,
Oh,
and the
okay.
most profound ones, having large nodules and cysts, giving a very bad scarring on the face, they are also acne.
Right.
Yeah.
Right. So, as you said, right, it's genetic as well.
Yes.
So I'll tell you, my both of my parents don't have acne. My sister has amazing skin. My brother has amazing skin. For some reason, when I was a teenager, like I got acne. So, as I said, the moment I turned 13, I started getting acne, and after that, because of some reaction of some product, I had a very bad, you know, whole, I think 2 3 months, my whole face was covered with acne. So at that point, I didn't realize it was a reaction. So what are the, like, difference between an allergic reaction or just like normal hormonal acne?
It's actually not an allergic reaction.
Okay.
It is called as comedogenicity of a product.
Oh, okay,
There are
right.
various products, generally the little oily ones, which have a tendency for forming acne, which is
Right.
called as comedogenicity. Comedones is the term used for the blackheads and whiteheads which we normally see,
Okay.
and that's why comedogenicity is the ability of the product to lead to acne.
Right.
So the old time products, the greasy ones, and the old, cosmetics which were not very loosely used, had a lot of comedogenicity. So whenever you used to use them, it's also called as pomade acne. So
Okay.
they get a lot of pimples. But now the cosmetic industry has become well aware about this, and more products which are non-comedogenic and they do not generally cause acne are brought into market. So generally, if you use non-comedogenic products, the chance of getting cosmetic acne is relatively less.
Right.
Secondly, regarding your own case, again, the familial tendency is one thing.
Right.
Probably because you did not have a familial tendency, probably the recovery what you had was very good, and that's why there may be some environmental factors or external factors which caused pimples in your case,
Right.
which
Maybe,
got
yeah.
better with time or with some treatment, and then you are absolutely okay now.
Yes.
But that is probably because you did not have a familial tendency. You will many times find a person coming with a lot of acne, and accompanying mother has got acne scars. So
Right.
that's a very common thing, and we see that happening in our regular practice.
Right.
So there is a familial tendency, and second thing is that familial tendency does not mean that if the mother has severe acne, the daughter or the son has to have it. It's just a factor. It just increases the possibility of having acne or having more severe acne.
Right, right. So, even a small pimple can leave a very big impact mentally to a person's confidence, right? So, what is something you would like to let them know or tell them about
I
it?
fully agree with you that I mean everybody is conscious about his presence
Right.
socially, and especially so in today's world when people are conscious. They have to present themselves in the peer groups. They have to have reels and they have
Yeah.
to present on social media. And for all these purposes, even the slightest blemish on the face definitely reduces the confidence level of that person.
Right.
It never happened in our times, but today I can see kids missing out on their schools and colleges for weeks together just because they have got a flare of acne. This
Right.
was never, I mean, I can see adolescents who are coming to me as patients when their exam is just 15 days away. I mean,
Hmm.
a 12th standard exam 15 days away, and they are disturbed because of pimples and they are coming to me.
Right.
So, the sort of an awareness about pimples and the loss of confidence because of it is profound in today's world, and that's why we have to, I mean, cater to that. We have to address that concern. Especially parents have to understand that this part of acne has to be understood well without ridiculing your adolescent boys and girls. They have to understand that acne is an important problem. It definitely disturbs their morale and
Right.
has to be taken care of.
Right. And you said it very correctly that, now it's like you are being seen 24/7.
Yes.
So they may have that, consciousness about how they are looking and how people are seeing them.
I mean,
So,
nowadays, if the that person has not sent a selfie for a day, I think
yeah.
he will must be getting at least 10 phone calls from the peers that where are you, are you
Right.
away, and are you not well, etc. So
Right.
that's the way. I mean, see the life. I mean, flows, and today's life requires a clean skin.
Right.
Secondly, definitely, I mean, this is a peer group, it's okay. But even in employment, in marital alliances, all this, I mean, whether you like it or don't like it, um, the appearance of the person definitely takes an important, it may not be said in the interview, probably nobody will put it on the paper,
Right.
but definitely a person with a pleasing personality is picked up. That's the crude reality of life, and
Right.
that's why everybody will obviously like to have a clean skin, and pimples are the one of the worst things which will disturb the cleanness of your skin.
Right. Sir, I have one more question about ingredients. So we see a lot of active ingredients in the market. I must have 4 5 in my house as well. So what are some of the ingredients which actually help with acne?
See, there are two types of ingredients. Some ingredients which are used by doctors, because those
Right.
ingredients have a potential irritation, so they have to select out a proper ingredient. Like the ones which are used by doctors are tretinoin, which is a
Right.
vitamin A derivative, then benzoyl peroxide, then antibiotics like clindamycin. These are used by doctors.
Right.
In cosmeceuticals, many times other ingredients like salicylic acid in weak concentration. Salicylic acid is also a drug, but in weak concentration it's okay. Then niacinamide, retinol, these are certain drugs which are used.
Right.
Secondly, patients have to use, I mean, these are used generally in night creams, but patients also use moisturizers to balance their skin. Then they use face washes.
Right.
Actually, all these things are good, but the patients have to understand that these things can correct the acne, which is very mild.
Right.
For a relatively severe acne or even a slightly modest acne also, these things cannot be considered as a treatment.
Okay.
Patients come to me and they said that I'm using moisturizer, sunscreen and a face wash for a long time, doctor, but my acne is not getting treated. But basically that's not a treatment. I just ask them whether by just eating achar and raita,
Right.
does your appetite get quenched? It's not. So it is always a side dish. So
Right.
moisturizer, sunscreen and face washes in a slightly severe acne are always a side dish. So it's okay when the patients use it themselves, nothing wrong about it. So many products are available, but we have to consider number one, the product should be non-comedogenic, as I already told you.
Right.
So they themselves should not cause acne. They should not be irritating.
Mm-hmm.
Thirdly, the product should be such that they do not contain any sensitizers. Now, it's very difficult to say. I mean, patients cannot understand which are sensitizers, which are not. There are
Right.
certain irritating substances which are present in some certain products, like sodium lauryl sulfate, which can
Okay.
be irritating. So all these things are taken care by the cosmetic industry in most of
Mm-hmm.
the, I mean, good products. I mean, take care of all these things, non-comedogenic products, using right emulsifiers. All those things are done. So, and patients when they change the product and when they are using a new product, they have to be very vigilant about the irritation, comedogenicity, and overall feel of the product,
Hmm.
and always be aware that that cannot treat every kind of acne.
Right.
So mild acne is okay; they can use self, I mean, treatment. But a little severe acne, they have to go to a dermatologist
Okay.
and take a proper scientific medical treatment.
Right, right. So when it's come to acne, how big of a role does hormone has when it's come to adult acne?
Hormones have a profound role in acne. Some people say that even acne is a hormonal disease.
Right,
It's that important because the basic cause of acne is androgen or the testosterone, which is a male hormone.
right,
Both in males and females alike. And these androgens increase the sebaceous production, sebum production. They change the follicular, I mean the cell structure of the hair follicle and the sebaceous gland, and
right,
because of that, they are of importance in all the patients. You will find many females getting premenstrual flare. That means just
right,
before their monthly periods, they will get increase in acne.
right, yeah.
To certain degree, it is normal, but in certain girls, this is an indicator that probably they are having some kind of a hormonal trouble.
Okay,
There is a condition called as PCOS or polycystic ovary syndrome, in which there is a slightly increased action of the androgens in the female body, basically because of hormonal imbalance. This can be because it can be familial, it can be because there is an increased amount of luteinizing hormone, it could
okay,
be because of obesity,
right,
so many other things are there. So because of that, in PCOS you will find acne to be more profound, and most of these PCOS girls later on may have may have adult acne.
hmm. Right,
Another reasons for adult acne are the use of oral contraceptive pills, which are used in later age, the
right,
cosmetics, the increased modern day stress, which always comes in picture. So
right,
all of these things have led to acne age almost till 35 or 40. So
okay,
if I get a lady who is already married, having
hmm,
one or two children, and sometimes even having a family planning surgery done, I won't
right,
be surprised if she gets acne.
right,
So, I mean, these are the basic profound effect of hormones. In
okay,
addition, whenever the external hormones have to be given for
hmm,
some or the other reason, a lady has to take it as a contraceptive pill.
right,
Suppose
yeah,
she, for some reason, she has to postpone her menses, she takes some pills again, or there is a, I mean, a male who takes testosterone. I mean, this is not indicated, but
right,
so many people to improve their body, I mean, shape, they take androgens or testosterone.
okay,
All
right,
this may lead to acne.
right,
So, hormones and acne go hand in hand, and that's why most of the patients who are taking oral contraceptive pills may get at least some amount of acne,
hmm,
and especially when they withdraw the pills, there is another flare up.
right, right,
So, even while taking pills, we have to take care. Certain pills actually improve acne, and certain pills increase acne.
right,
There are pills which contain a drug called as sapropteron and drospirenone. These pills generally improve acne.
okay,
That's why whenever I mean the patient is already taking oral contraceptive pills, I request the gynecologist to shift to these pills if it is feasible, unless there is any problem.
Right.
So, so hormones and acne is a very, very important thing. Whenever I get resistant patient of acne, I get all their hormonal tests done to just find out whether she is suffering from PCOS.
Right. Okay. But I have also seen a lot of women who are suffering from PCOS, but amazing skin they have. That's all for this part of the episode. We have discussed some amazing information on acne. I know you are eager to know more about acne and the best way to take care of it, so stay tuned for part 2.